6 months ago, the World Health Organization declared the spread of the novel coronavirus a public health emergency of international concern after infections in China spiked tenfold in less than a week.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
Those concerns have become all too real. On January 30th, there were 7,836 confirmed coronavirus infections in 18 countries. 6 months later, there are more than 16 million confirmed cases in at least 213 countries and regions. More than 650,000 people around the world have died from COVID-19, the disease caused by the virus. In March, the WHO officially declared COVID-19 a global pandemic. Here's what we've learned during the past 6 months about the novel coronavirus and COVID-19. The coronavirus is most commonly transmitted through respiratory droplets, which people breathe out of their noses and mouths that become airborne and infect others. This is why many health officials around the world are asking people to practice social distancing, keeping at least 1 meter away from others. People are also encouraged and in some places ordered to wear a face mask to prevent droplets from getting into the air. The virus can also be transmitted through contact. This is why regular and thorough hand washing is important, especially after any contact with high-touch surfaces such as doorknobs, handrails, and lift buttons. The most common symptoms of COVID-19 are fever, fatigue, a dry cough, and shortness of breath. Other symptoms may include nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, skin rashes, or discoloration of fingers and toes. But many of these symptoms can also be associated with the common cold, seasonal flu, and other illnesses. The only sure way to know if you have COVID-19 is to get tested. Data from the United Nations World Health Organization shows that most people infected with COVID-19 recover. But about 4% of people infected with COVID-19 globally have died from it. So far, COVID-19 is less deadly than respiratory diseases caused by other coronaviruses. Severe acute respiratory syndrome, or SARS, had a death rate of about 10%, while the mortality rate for Middle East respiratory syndrome, or MERS patients, is 34%. There are many cases where people who test positive for COVID-19 don't show any symptoms at all. That's caused concern that asymptomatic patients could be unknowingly transmitting the virus to others. According to the WHO, evidence collected from contact tracing so far suggests asymptomatic carriers are less likely to transmit the coronavirus to others than those who develop symptoms. But the WHO says more research still needs to be done. Although the pandemic is global, world leaders and health experts have not reached a consensus on the best way to tackle and ultimately stop the pandemic. Some governments have taken extreme measures. The Chinese city of Wuhan, the first epicenter of the pandemic, was placed under a complete lockdown for 2.5 months before the last patient from the initial outbreak was discharged from hospital. New Zealand went into lockdown for nearly 12 weeks and was the first country in the world to declare itself COVID-19 free, although some cases have been confirmed there since. European countries such as Italy, Spain, and France also implemented strict lockdowns. But the Swedish government initially called on its citizens to use common sense to carry the country through the pandemic. It only implemented some social distancing measures after infection numbers surpassed figures in neighbouring countries that had imposed lockdowns with stiff penalties for violators. The United States currently has by far the most COVID-19 infections, with more than 4 million confirmed cases. The federal government has largely left it up to individual states to decide on an approach to controlling the spread of the virus. And US President Donald Trump, who has been pushing to restart the economy and reopen schools, has butted heads with state governors who refuse to lift restrictions because case numbers continue to rise. Several US states continue to report record numbers of new infections and deaths on a daily basis. But none of the measures taken by governments offer any guarantee against a resurgence of the virus. Many places that initially did well to control the spread have suffered second or even third waves of infections. Coronaviruses generally survive longer and stay active longer at lower temperatures, but COVID-19 can also spread in hot and humid climates, as shown by the steady rise in cases during the summer months in the northern hemisphere. However, health officials warn infection rates could rise further as the weather starts to cool in the north, and people spend more time indoors, living in close quarters with little ventilation. Dozens of labs around the world are working to develop a much-anticipated COVID-19 vaccine. Some have conducted human trials that show promising results. The UK government has already ordered 100 million doses of a vaccine being made by scientists at Oxford University. Trials on more than 1,000 test patients showed that the vaccine led to the production of antibodies and T-cells that can fight the coronavirus. And a vaccine under early development by Chinese researchers produced significant immune responses to the virus in tests on hundreds of volunteer patients. But it could still take months, possibly years, for a vaccine to go through all the necessary trials and to get all the approvals needed for mass production. Making sure it can be quickly produced and distributed around the world will be another major hurdle. Until then, people everywhere will need to continue to find the best ways to live with and keep themselves safe from COVID-19.